Welcome back, everyone. Many places got a late start to the day today after the threat of slick roads and even snow. Area clinics were among those out of their regular routines today. Our Cash Matlocky joins us live in the studio with how health officials say they're going to catch up from the late start. Cash.
As it turns out, delays caused by winter weather not only had an effect on patients in need of care, but they could also have an effect on hospitals and clinics from a business standpoint.
We do have our policies in place. In the event that we do have inclement weather, we know exactly what the policy is and how to abide by that.
Janet Cranford is the Director of Operations at Baptist Medical Group in Columbus. She says area clinics have a plan of action when it comes to winter weather.
We do always print our patient schedules the night before, so our staff has access to those patient schedules at home, and in the event that there needs to be a delayed start, they can contact the patients and let them know that.
And if the clinic closes for the day, Cranford has a solution to that as well.
The ER is always open and available, so in the event that the patient needs care, there's always the opportunity for them to come to the ER.
Cranford says a delay in the schedule could have long-lasting consequences.
It certainly has a ripple effect because those patients are on the schedule for that day, whether it be that the patient sees that they can't make it to the clinic or maybe we don't have enough staff there. Those patients have got to be seen at another time.
Delays can also have financial effects on clinics.
The financial effect, of course, is that if the weather is very inclement and patients can't get here, we might not see as many patients that day. But typically, as I said, you're going to see that you make that up when the weather is pretty and they can get there.
And she says the main issue clinics face every year is staffing.
I think the biggest issue becomes parents who have children that are not in school and maybe they have to make arrangements for their children.
And regardless of the weather, Cranford says patients only need to know one thing.
Our policy is our clinics are open. In the event something happened and we couldn't be, we would always reach out to the patient first.
Cranford says patients should carry on in a business-as-usual fashion unless otherwise notified.